University Lima campus. And John's a member of our leadership team for Activate Allen County, and he is going to introduce our keynote speaker for lunch.
Thank you, Jerry. Please continue eating. You're in for a treat, and it's not a dessert, it's going to be with your lunch, and that's the speaker that we have today. And I can say that because I had the privilege of hearing Dr. Schwartz talk. When Jerry took a small group to Washington as we were planning this, is that 2 years ago now? 2 years ago. Jerry mentioned that we're on a journey, and indeed it is a journey toward improving the health of our community. And a year ago, Mark Fenton was here, and we took the first step on that, and we're continuing that today. Let me tell you a little bit about our speaker, our keynote speaker for this afternoon. Dr. Marlene Schwartz is the director of the Rudd Center for Food Policy and Obesity at Yale University. Prior to joining the Rudd Center, she served as co-director of the Yale Center for Eating and Weight Disorders. Her research and community service addresses how home environments, school landscapes, neighborhoods, and the media shape the eating attitudes and behaviors of children. She has received funding to do studies on school wellness policies, the preschool nutrition environment, the effect of food marketing on children, the relationship between food insecurity and nutrition, and how federal food programs can improve the accessibility and affordability of healthy foods in low-income neighborhoods. Taking a page out of "It Takes a Village to Raise a Child," it takes the whole community to improve our health. Ladies and gentlemen, help me welcome Dr. Schwartz.
Thank you. Well, thank you very much. I'm delighted to be here. This is really impressive, I have to say. This is my first time here in your community and hearing all of the thoughtful questions that everyone has. You are so far ahead many parts of the country in terms of thinking about this issue. So what I'd like to spend my time doing today is to give you some of the background research on how people are influenced by the environment. And so I'm going to present some studies that document what influences our eating. I'm going to explain a concept called optimal defaults. And then I'm going to tell you some about the research that has been done on making changes in schools and what some of the challenges are in doing that. And then finally, food marketing to youth sort of emerged naturally in the conversation, which I thought was terrific. That's another place that we've done a lot of research at the Rudd Center. Just briefly, the Rudd Center is a research center at Yale University where our mission is to improve children's nutrition. And we have a team of folks that do studies, but more importantly, then really try to get the information out to policymakers, to communities, to others, advocates who can really use that information. And so we really try to do research that's relevant to real life issues. Okay, so I started off, why did you eat that? Now I had to say, oh, sorry. Okay. I have to say that the breakfast and lunch at this conference wins the prize as the healthiest breakfast and lunch of any conference I've ever been to. And as you can imagine, conferences I go to are pretty healthy. So you probably have gotten pretty far in terms of your 5 servings of fruits and vegetables today. But one of the things that I think is important to understand is how hard it often is to eat healthy and how difficult it can be to choose healthy food when there are a lot of unhealthy options around. Now, some people think, especially with children, that if we just sort of left them alone, that they would naturally gravitate towards the healthy food, that they would eat when they're hungry, they would stop when they were full, and they would maintain a healthy body weight. But if we look at the animal research, it actually paints quite a different picture. So here's a rat, and as you can see, he's there with his Purina rat chow, and there is more there than he needs. But the rat intuitively knows to eat enough and then stop eating and stay healthy. Well, what researchers have done is they have actually done studies where they've given rats what they call the supermarket diet, which you can see is a very high sugar, high fat, high salt diet. And what they find when they do that is that the rat actually triples his body weight. Now, this is really remarkable because clearly the reason the rat is doing this isn't because he's depressed or, his mother yelled at him or he's been watching too many commercials. The rat is eating this because we are biologically predisposed to prefer high sugar, high fat, high salt foods. So whatever natural biological mechanism we might have to make healthier choices, if the unhealthy choices are surrounding us, it is very difficult to resist them. Now, if you look carefully at the slide, you can see that the healthy choice is still there. Like right next to his little paw, there's a Cheeto, and then there's some of the rat chow. So technically, this rat has a choice. And if this rat, were in any way, sort of knew that he had to have something healthy, he would eat the healthier food, but he doesn't. And so it's really not always enough to just provide the healthy food. You also have to think about limiting access to the unhealthy food. And here's a picture of the two little rats together. So I'm going to just go through some studies that really show how what we eat is influenced by things that are completely unconscious. We don't even realize it. So the first is portion size. There have been a number of studies that have showed that children, and this is true for adults too, we will eat more food when we are served larger portions, even when our hunger levels are the same. So there has been research done by someone named Barbara Rolls at Penn State University, where she gives children in a preschool a large serving of macaroni and cheese one day for lunch, and then a week later a much smaller serving of macaroni and cheese. And what she finds is the kids eat more when the amount on their plate is more. So there's something about the visual cue of how much we are served that tells us that we should keep eating. Brian Wansink, who was actually mentioned this morning, has also done a lot of research where he gave people popcorn as they went into movie theaters and found that if you gave people a big thing of popcorn, they ate a lot of popcorn. If you gave them a smaller thing of popcorn, they ate less. Then he actually did a version of the study where he left the popcorn in his garage for a couple weeks so it got really stale, and he still repeated it, and the people still ate the popcorn. And he asked them afterwards, why did you eat that popcorn? And they were like, yeah, I know, it was really terrible, but they ate it anyway. And so I think what it really points to is the power of having the food in front of you and that automatic impulse to eat it. So when you think about serving size and you think about this obesity epidemic that has really risen so rapidly in our society, you have to think about how has the food environment changed during that time. And one of the ways it's changed is the normal portions of things like sugar-sweetened beverages have really skyrocketed. So originally, sugar-sweetened beverages came in smaller 8-ounce containers, was considered a serving. Interestingly, 8 ounces is still considered a serving. But what you buy and what's sold in vending machines is more like 20 ounces now. So that's one place. These are from 7-Eleven, sort of the original gulp, which was supposed to be really big, was a mere 16 ounces, whereas now the double gulp is actually 64 ounces. And I've actually heard that some car manufacturers have had to make the cup holders bigger in order to accommodate the larger cups that people get from some of the drive-thrus. So the second thing that really affects us is accessibility, that people eat the foods that are most easily available. So another study that Brian Wansink did is he went into an office building and he put bowls of M&Ms in there. And he either put bowls of M&Ms on people's desks or he would put it on their printer stand that was a couple feet away. And then, they went about their day, and at night he and his research assistants went in and they actually counted up to see how many M&Ms were eaten. Any guesses as to whose M&Ms were eaten first? Yes, the desk. And when he asked people afterwards, they said, well, it was just right there. It was easy to just sort of reach over and grab it, whereas, just moving it over 2 feet so that they actually had to stand up and walk a step to get it slowed people down. Another condition of this study was the M&Ms were either in opaque containers or clear containers, and I'm sure you can guess whose M&Ms disappeared first in this condition. It was the clear containers. So that visual cue of constantly seeing the candy in front of you led to greater consumption. So this is a very simple study, but I think it really points to how we think we make choices about what we eat, but some of those choices are not conscious, cognitive, informed choices. They're really just automatic responses to our environment. I think one place that's really interesting to look at this is when you compare teenage milk and soft drink consumption over time. And these are data from the USDA, and you can see back in the late 70s that both boys and girls drank both milk and soft drinks, but they drank more milk and fewer soft drinks each week. But by the mid-90s, milk consumption had dropped and soft drink consumption had gone way, way up. And so you can think to yourself, well, why is that? Why has it changed? And I would argue that one of the reasons is by the mid-90s, nearly 100% of American high schools had vending machines inside the school. And so the fact that those soft drinks were available all the time, I mean, when I was in high school, it was milk or the water fountain, and those were your choices. But this generation of children grew up having access to soft drinks in their school every single day, not to mention walking past that vending machine, seeing the logos and being cued for that constantly throughout the day. So another interesting set of studies was looking at something called sensory-specific satiety. And basically, the idea is that the more variety there is in what we're eating, the more we're going to eat. So if you are eating, let's just say, you're at a nice restaurant and you just had a really big meal and you're totally full. And then the waitress comes over at the end and says, well, here, let me show you the dessert tray, and pulls out these desserts and shows you all these delicious desserts. Have you ever noticed how you're not that full all of a sudden and you actually feel like you could have a little bit of room for some dessert? Well, that's this effect where once you're satisfied with a certain flavor, you often can start to feel hungry again if you are exposed to a new flavor. So the place that also comes up is at buffets, that when you go to a buffet that has lots and lots of variety, there's a tendency to want to have a little bit of each thing and sort of try it and not, just have one thing, and that does lead to greater caloric consumption. Now, interestingly, Brian Wansing did yet another M&M study where he had a party and he had bowls of M&Ms around, and in some of the bowls he had a bunch of different color M&Ms like you see here, and in other bowls he only had one color M&M. Amazingly, the multiple color M&M bowls went first. Now, that's ridiculous, right? Because it's not like different color M&Ms taste different. But what it, again, really reinforces is there's something very intuitive and automatic of wanting to get variety when we see it in front of us. Now, an interesting illustration of how this has been used in terms of selling food is this product, which is called Munchies Kids Mix. Now, I was at a conference in California for the American Dietetic Association a number of years ago, and they have a very large expo where they have food companies there sharing new products. And this was from the Frito-Lay, place, and I went over, and the person from Frito-Lay was very proud to tell me this was their new product. They'd done focus group with kids, and they talked to kids, and she said, what kids really told us is what they want is a combination of Doritos, Cheetos, pretzels, popcorn, Captain Crunch, and M&Ms. And I was like, yeah, I bet they told you that. And so they decided to make this product. Now, interestingly, if you look at it carefully, it has 8 essential vitamins and minerals included. So there's a little bit of effort to try to, convince mom that this is actually a healthy product. Now, I looked at this and I thought to myself, that looks just like my rat slide. And what does that say about us? That we are essentially packaging and promoting products directly to children that are using every trick in the book to try to increase consumption. And so I think that, we really have to look carefully at the environment our kids are growing up in and understand what it is that might be leading them to eat more food than they need. Now, I'm just going to show some slides, and you guys, I think, are already on board with this, but this is one way to maybe talk about it with other people who haven't quite gotten to this point. So for years and years, I was a clinical psychologist. I was treating eating disorders and obesity, and I worked with people one-on-one. And there's a very long history of treatment for obesity that dates back to probably the 1960s that's really based on teaching people individual skills. So the idea has always been knowledge can go to the individual, motivation can go to the individual, and you educate them, you implore them, you may medicate, you may operate, but the whole idea is that all of that focus on the individual will lead to less obesity. Well, unfortunately, it just doesn't work very well. And so another way to look at it is to think about what is it that is happening before the sort of individual makes that choice. What is the marketing, the availability, the cost, the convenience of the different foods? And I would argue that it is creating what you could call a toxic food environment, where there's sort of everything is conspiring against eating the healthier food because the unhealthy foods have all of these things going for them. And so what really needs to happen is there needs to be policy change at every level that will change that toxic environment and create what I would call optimal defaults. Those then can influence the individual, and that can then improve health. Now let me explain what I mean by optimal defaults. You talk a lot, everybody talks a lot about choice. And the idea when you talk about choice is that somehow it's an even playing field, that you have there's just as much pressure on you to make choice A as choice B, and it's like a 50-50 chance which one you're going to pick. Unfortunately, that's actually not true in most real-life situations. So here's one example. A study was done at Harvard where they looked at companies that offered pension plans. And in one group of companies, if you went to work for that company, you were automatically enrolled in the pension plan. If you wanted to get out of it, you could certainly go and tell HR, please unenroll me. But if you did nothing, you were in it. The other companies, the employee had to actually enroll. So the default was you were not enrolled, and the employee had to call HR and enroll. At the end of the year, nearly 100% of the people in the automatic enrollment were enrolled, and less than 50% were enrolled in the second condition. So it really wasn't an equal choice. There was a default, and people needed to take action to change the default if they wanted to. And what's clear from this and other studies is that people don't change the default. We basically go with whatever the default is in many situations. Here's another example. Studies have looked at organ donation in different countries. And there are a number of countries like ours that you have to sign up to be an organ donor. So when you get your driver's license, they fill out a card and then they put it on there. And you can see what the rates of organ donation are. In contrast, there are a number of countries in other parts of the world, particularly in Europe, where you are an organ donor unless you say you don't want to be one. So the default is that you are. And look at their rates of organ donation. I mean, it's unbelievable. 99.97, people are organ donors in a lot of those countries. And from a public health perspective, you can't get 99% of people to do anything. The fact that they were able to, get organ donation up to that level, I think is really interesting. So the question I pose is, how can we then design policies that will create these optimal defaults for children's eating? And I'm going to make the case that schools are a good place to start. First of all, they have access to our kids. The National School Lunch Program serves 27 million meals each day. There is a precedent for schools setting higher safety and health standards that, we as parents, we send our kids to school, we expect there's not going to be lead paint, there's not going to be asbestos, there's not going to be, things that are known to be kind of public health concerns. And it's also the ideal setting to combine the education with the environmental change. Now, one thing that I learned when I started doing this kind of research is there are a lot of places that you find food in a school setting. There's the cafeteria, which is what we think of first, where there's almost always lunch, there's sometimes breakfast. They have a la carte, which is when they sell items sort of in addition to the school lunch, and then there are vending machines. There's often food in the classrooms in the form of parties, fundraising, or teachers using food as a reward. There can be food in the hallways where, again, vending machines, school stores, or kids at their club fundraising between classes. And then outside on the school grounds, again, is another popular site for fundraising, particularly sports events having boosters have concession stands. So when you really look comprehensively at the school food environment, there are lots and lots of places that you can try to make policy change so that these are all providing healthier options instead of unhealthy ones. Now, there's been a number of research studies that have shown that what kids get in school really matters. So there's evidence that the children who actually eat the national school lunch, as opposed to eating either competitive food or bringing their own lunch, eat twice as many fruits and vegetables. And as kids transition to middle school, so elementary schools tend to not have as many choices, they don't have as many vending machines and things like that, but when kids go to middle school, their diets tend to deteriorate, they have fewer fruits and non-fried vegetables, they drink less milk, and they drink more sweetened beverages. So clearly that environmental shift has an impact on kids' diets. Now, at the same time, people who are in schools without a la carte, where they only sell the school lunch, eat more fruits and vegetables and have fewer calories from fat. And schools that have more policies, sort of official school policies that limit consumption, so things like not having vending machines, having policies that teachers aren't allowed to hand out candy as a reward, or fundraisers need to be non-food or healthy food fundraisers, they have a lower prevalence of obesity. Now, when you talk to people at schools, and I know there are some in this audience, and I've talked to a lot of them in my own town, their first reaction is, you guys, come on, our job is to educate children. I mean, everything gets dumped on the school. The school is expected to, do all kinds of health screenings, and they're expected to, keep track of, all kinds of different potential problems that the kids might be having. They're totally getting squeezed. Every minute is accounted for. There's state policies, there's federal policies. I completely understand. And I think what you need to sort of think about, though, is that this goal is entirely consistent with student academic achievement. So we're doing a study in New Haven where it's a pretty homogeneous city. Basically, it's completely free lunch. Everybody gets a free lunch because the level of poverty is so high. And we went in and we assessed the children through surveys and physical measurement, and we then got their test scores. And we looked at the relationship between their test scores and a number of health and wellness factors that we measured. And what we found, and these were all significant relationships, is that kids at a healthy weight who were physically fit drank fewer sugary drinks, ate less fast food, did not have a television in their bedroom. That was the biggest predictor. Less screen time and got more sleep, all had significantly higher test scores, were significantly more likely to reach that level. Now you can say, well, it's because the real driver is poverty or the real driver is parenting, but I think there's this vicious circle where kids who are at risk to begin with, if they then are unhealthy because of their environment, it's just going to make it harder for them to achieve and to eventually get themselves to a better place. So it's sort of this, circle of the poverty is influencing their health, and then their poor health is perpetuating their poverty. So just a little history on the National School Lunch Program. It's a very old program. It was signed into law in 1946 by President Truman, who said no nation is any healthier than its children or more prosperous than its farmers. And interestingly, when it was first started, it was really a combination of human nutrition needs and agricultural system needs. And so it was this idea that when you had agricultural surplus, you could then use it to feed the children in schools. And the way it's structured, the federal government runs it. They provide the money to the states. The states then administer the program. And there are 3 categories of pricing based on student income. And you can see this is the amount of money that you get for kids who pay for lunch, for kids who get a reduced rate, and for kids who are free. And I'm putting this up here because it's going to apply to some of our research findings I'm about to share. Some states actually provide additional money above and beyond the federal reimbursement. I don't know if Ohio is one of them, but some states do. So the original concern was undernutrition. There was, just as the military is now saying, too fat to fight, the military was saying back then, these kids who are showing up, these young men are not well nourished. They're not healthy enough. And so they really were focused on calorie minimums. There were no minimums on or maximums on sugar, fat, or calories. And because of the way our food system changed over all these decades, it went from originally being, food that was made in a kitchen or food that was made by, moms who then would come to the school to processed food. And if you went into a school cafeteria within the last 10 years, you probably would see things like hamburgers, fries, chicken nuggets, hot dog, corn dogs, macaroni and cheese, all the sort of kids' food things. So the research, people were starting to, worry about kids' nutrition and whether or not the school lunch program was helping them. And the research was done and actually found that when you look specifically at what you would think of as empty calories, they're referred to by the National Cancer Institute as SOFAs, solid fats and added sugars, that the kids were getting 115% of their daily SOFAs from lunch. Middle school and high school kids were also getting more than half to 3/4 of those. And the reason I point this out is I'm not someone who says, oh, you should never have a cookie or you should never have a piece of cake. You're, supposed to have a certain amount of what they call empty, or it used to be called discretionary calories, and that's your dessert. But for most of us, sadly, that amount is about 200 calories a day. So when you really start looking at, the size of some desserts, you realize that you have to kind of watch your portion size. So it's not that kids, shouldn't have those foods, but it's that they were getting home from school, and in elementary school, they've already not only had it all, but beyond what they should be having. And these are the leading contributors to those. So the federal government, after much, much lobbying by the advocacy community, decided that they were going to step in, and there was a federal law passed called the HungerFree Kids Act. It was signed in 2010, And what it did is it required the USDA to update the National School Lunch and Breakfast Regulations, so the actual foods they were required to have. It gave authority to the government to regulate competitive foods, and it also required school districts to have school wellness policies. Those had actually been required for a little while, but it required some additional components to those policies and making the policies public. So, you know, one question is this really going to help? Is this going to make any difference? Well, our research suggests that it should. So we did a study a number of years ago when Connecticut started trying to make changes at the state level in what they were selling in schools. And I worked with the Department of Education to do a study where we had some schools actually remove all of the snacks and beverages that didn't meet state nutrition guidelines, and then some schools remained the same. And the food service directors were given lists of approved beverages and snacks. The biggest question was, what's going to happen to the money? Are they going to lose money? Well, what we found is that the pilot schools did not lose money. So that was everybody's fear. This is what happened. The a la carte sales did go down. So if you substitute, you know, fresh fruit and yogurt and things like that for ice cream, cookies, and potato chips, kids don't buy as much. Okay? But what happened was, because the competitive foods were no longer these sort of super appealing snacks, it was like the kids were like, oh, fine, I'll just go ahead and get the school lunch. And then they bought the school lunch or took the school lunch if they were free, and the school got the money from the government for that lunch. And so what ended up happening was, as lunch sales or lunch distribution, if you're talking about free kids, increased, the income actually went up instead of down and compensated for the lower a la carte sales. We looked at this back in 2008. There have been a number of studies since then, and while this doesn't happen 100% of the time, the vast majority of the time, this is what happens when you take out the unhealthy foods. Now, I was interested not just in the financial picture, but in the health picture. So we had done surveys on the kids before and after these changes to see how it affected their diet. And what we found was they ate more healthy snacks, they drank more water, they ate fewer unhealthy snacks, they drank fewer unhealthy beverages. Someone had said, you know, you might cause eating disorders because you're sort of telling the kids there's something wrong with them and it's giving this bad message. So I checked for body image concerns, unhealthy dieting practices, nothing changed. Then people said, well, aren't they just going to eat more of those foods at home? Like, you can take it away at school, but it's becoming, you know, the quote, forbidden fruit, ironically, and they're going to then go home and binge on it, and because you've made such a big deal about it. Well, we assessed that, and what we found was between the year 1 and year 2, kids were eating the foods at both school and home. So school was the red, home is the ice cream cone. And at the second, after they were removed from the school, they still ate them at home. They obviously ate less at school, but they did not compensate. So it isn't like the kids had this internal potato chip monitor that was like, you didn't have your quota today, and 3 o'clock they all of a sudden had to go rush and start eating their amount of potato chips. We looked at it across every category, all the different foods that had been changed, and we found the same thing. So the worry that kids would compensate, there's no evidence to support that. So I sort of think of this as that, you know, people thought absence would make the heart grow fonder. It was more like out of sight, out of mind. So now comes another study, and I have to say, I feel a little badly about this study because I think that this study might have been one of the reasons that the very unpopular regulation of requiring the kids to take our fruit or vegetable might have been put in. So let me explain the study and what we found. I had gone to my daughter's school, and I had seen that the school lunch basically had these, 6 components, 5 required, and then sometimes some additional components. Basically, in order for the school to get reimbursed, they had to have protein, milk, grain, fruit, vegetable, and sometimes they could have extra, dessert or something like that. And as I was watching the kids go through the line, what I saw is most of the kids took the protein, the grain, the milk, and then walked right past the fruits and vegetables. And 3 components was required in order to get reimbursed, so that was fine with the food service. Now, thinking back to Brian Wansing's M&M study, I kept thinking, well, if I can just get it on their tray, right? It's the difference between having it on your desk versus the file cabinet. If I can just get the fruit on their tray, once they sit down, maybe they will actually eat it. So the idea that we had was to do an intervention where we had the people working in the cafeteria not force, but have a verbal prompt to tell the kids to take a fruit or juice serving. Now, juice counts as a fruit serving, so oftentimes they'd have, like some cut up fruit and some juice, and the kids were allowed to take either one of them would have counted. And so the way they asked it is they said, would you like some fruit or juice? Now, this is a little sneaky, and those of you who are parents are going to know exactly what I'm talking about. Sometimes you give your child a choice where the implication is you're taking one or the other. But it sounds like a choice because you're saying, would you like, an apple or a banana? Or would you like, a peach or a nectarine? And so the kids felt like they were making a choice. They took it. If a child flat out refused and said, I don't want it, fine, we didn't force the issue. And then what we did is we measured how many kids took it, and in the control condition, we served the meal as usual. And then we went into the cafeteria, and I had parent volunteers who actually collected the trays at the end and measured how much was actually eaten. So we did plate waste data collection for that. Now let me show you what we found. In the control schools, what we found was about 65% of the kids, and this is under the regular old conditions where nobody says anything, took either a fruit or juice, and as you can see, the fruit's red, the juice is orange. They took more fruit than juice. And then we looked at how many ate it, and we found that about 70% of the kids consumed it. Then in our other schools, where we did the intervention, we found that the number of kids who took it went practically to 100%. I mean, only a handful of kids said, no, I don't want either one. And interestingly then, when we looked to see how many ate it, 70% ate it. So what this really shows us is that, the idea that the child makes this choice and only under those conditions are they going to eat their food is really not true. That even the kids who took it voluntarily, you could say, only 70% ate it. There's always plate waste in, school lunch and home as well. But once you get more kids to take it, the exact same proportion took it. So because of the intervention, we basically went from 33% of the kids eating their fruit to 55% of their kids eating their fruit. So I thought that this was really terrific. But the other side of this coin that you need to realize is if 70% are eating it, 30% are throwing it away. And the 30% that were throwing it away when less was being handed out is a smaller number than the 30% when more is being handed out. So the reason this is really important is that, there's been this big debate in the field about waste, having the kids take one serving of either fruit or vegetable has sort of pitted these two things against each other. Like, is it going to lead to greater consumption or greater waste? The answer, at least according to our research, is both. And so it really becomes a matter of, calculating the cost, figuring out what you can tolerate. Now, I heard Father Ross say that it sounded like only 3 or 4 kids were eating their fruit serving. So it could be that in some schools, there really is a need for a more intensive intervention. So here are some of the things that I think would be helpful to really try to make this new regulation work. Number one is variety. So you want to have a few choices. Now, by law, you need to have a fruit and a vegetable. So that's a little bit of variety right there. But if there's any way to at least have a couple of choices within those, a lot of schools will put in salad bars, which are a nice way of getting variety out there, then that will increase the number of kids that will take it and will actually eat it. The quality, we talked about this before too, there certainly is a difference in quality of, fruits and vegetables in our society, and especially in, a setting like a school. And so, it's a little bit of a catch-22, because if you feel like it's going to get thrown away, you're going to want to buy less expensive things, which probably means that the quality is lower, which then is going to decrease the chance that the kids are going to eat it. So there needs to be some effort to find the ability to go for the higher quality foods and then figure out a way to package it so it's easy for kids to eat. I mean, sometimes, just something as simple as peeling the oranges or cutting up the apple, really making it so that the kids can just quickly eat it, that they don't have to do a lot of work. And then the other thing, I think, is communication. You know your kids in your school, if you're a food service director or if you're part of a school wellness committee, and you want to talk to the kids. You want to do surveys. What's your favorite fruits and vegetables? What do you guys like? I mean, most kids like at least some fruits and vegetables. So find out what they like. Do taste testing. Get more sort of interesting things that maybe they haven't tried and have free samples and have the kids rate it. How much do they like it? School gardens is another way to get kids excited about it. Link the lessons lessons in class when you're teaching about either nutrition or even if you're teaching geography. You can talk about what kinds of fruits and vegetables grow in this part of the world. There's so many things that can be done within the school setting to really get the kids excited about eating those foods. And the nice thing is then it starts to become the new social norm. What sounds like sometimes happens is it almost becomes like the social thing to do is to refuse to eat it and throw it away. So you need to really turn that around and make sure that whatever's being communicated to the children about that food is really positive, gets them excited, and that they feel part of the process. So school wellness policies are another thing that I've studied a lot. Those were required back in 2006. They allowed districts to set their own policies. Now, what happened in a lot of parts of the country, I know this happened in Connecticut, is the State Association of Boards of Education wrote a model policy, and everybody basically took it and then put in the name of their district and sent it in. So that was not the idea. The idea was that you were supposed to form a committee with stakeholders, parents, kids, teachers, food service, administrators, members of the community, and you were supposed to really think through what you wanted to do in your school to improve the wellness. And so what we found in the research was, interestingly, the lowest income districts had the best policies. And I'm not even sure why that was. It may be because they realized it was more of a problem. It may be that, I don't know, that they sort of saw it as an opportunity to take this on. But we found that in Connecticut, and it's also been found nationally. But we really need to think of ways to get school districts to use this tool, because it is a federally mandated, thing, to sort of motivate everybody to come together. Now, in our studies, these policies are very comprehensive. They're not just about, birthday party cupcakes or, some of the things that people end up getting so upset about. They're actually about a lot of different things. And we have a coding system that we've developed, and you can see all the items there. And what we did is we actually coded all of the districts in Connecticut, and we sent out scores for how their policy did, both how comprehensive it was and how strong it was, and then compared them to the state average, and DRG stands for District Reference Group, so that's the cluster of districts that are similar to their district. And so we gave them feedback, and what happened was then people started to react. So New Haven actually had the best wellness plan, so they were very excited about that. Other parts of the state actually did not do very well, and parents got a hold of this information and went to the district and said, what's going on here? So Westport, which is actually a very wealthy part of our state, had a very low score. And so getting that feedback from the state actually prompted them to work on that. So this is one tool that I just want to mention. It's called the WellSet. So what we did is we took our coding system and we turned it into more of a user-friendly website where people who are in school districts can take their policy, and anyone can do this. It can be a parent, a teacher, somebody on the Board of Education, and they can compare their policy to what this system sort of says is the best practice. There's actually a webinar on the Action for Healthy Kids website that explains the coding. We're also available to answer questions at any time. But the idea is that the wellness policy should be a living document. It should be discussed. It should be used as a way of getting everyone organized around this and not just sort of stuck on a shelf or sent into the state and forgotten about. How am I doing on time? Only 5 minutes? Uh-oh. Okay, so the next thing I just want to talk about is quickly food marketing to kids. I put this up here because one time I was at the grocery store. I have 3 kids, and my oldest was at the time about 3 years old, and she was behind me, and we were in the sort of fruit snacks section, and I heard her saying, "Mommy, Mommy, I want this," and I turned around and I said, "What is it?" And she said, "I don't know." And so it was an interesting example of how marketing really works. This is actually what it was. So we did a study at Yale where we asked Yale people, and these were students, undergraduates, but I'm going to ask you to privately answer this for yourself. We said, do you think others are affected by advertising? So think to yourself, what do you really believe? Do you think you are affected by advertising? What do you really believe? Well, here's what Yale students said. They think others are affected either somewhat or very much, but they are affected at much lower rates only. So if you compare, the very much affected goes from 58% to 7%. So how can that be, that people are convinced that 58% of others are affected but only 7% of ourselves? Obviously there is a bias here. We have a hard time acknowledging that we're affected by marketing. Okay. So I'm just going to show you, this is really quick. This is a quiz. I want you to answer out loud. Silly rabbit. I go cuckoo for. They're magically. Have it your. Melts in your mouth. Does marketing work? I mean, come on. When's the last time I'm 47. I can't even tell you the last time I saw some of those commercials, but I still know the answer. So when you are marketed to like that, it lasts a long time. It does influence what you eat. We've done studies showing that the more marketing kids are exposed to, the more they choose that category of food. We've done studies showing that when kids play games on the computer that have characters that are made of the unhealthy foods, they'll eat a less healthy snack than when they play a game where they're playing with characters that focus fruit and vegetables. It absolutely has an influence, but we don't like to admit it. So one of the big projects we've been doing is going through different segments of the food industry and trying to show what they're marketing to kids, what the sort of nutritional value, encourage them to make some changes. So we started with cereal, and this just shows how much there is. Basically, this is the most marketed product to children. And the thing that's interesting about cereal is that there are healthy cereals, but very few of the healthy ones are marketed to children. So we asked the companies, why don't you market your healthy cereals to children? And they said, because children won't eat cereal without added sugar. So we did a study. We had kids come in and we assigned them to one of two groups, and they either got a choice of the high sugar cereals you see on the left or the low sugar cereals you see on the right. We wanted to know how would they eat differently given their choices. Again, we did the same thing, right? We still gave a choice. They were in one condition, but they still got a choice of 3 cereals. This was a camp. We gave them the whole box. There was milk, juice, fruit, and packets of table sugar because someone said, oh, well, they'll just add more sugar if you don't put the sugar on first. So we're like, okay, we'll test that. So we first asked them how they liked it, and as you can see, the high sugar and low sugar cereal scored virtually the same. Then we looked at what they ate, and let me just explain this to you. So the yellow bar is the amount of grams they ate of just the cereal. The red is what they ate of the sugar in the cereal, and the black is what they added in terms of the sugar from packets. And we divided the kids into the younger and older kids. So this is the high sugar condition. On the left is the 5 to 7-year-olds. On the right is the 8 to 12-year-olds. And you can see that they ate, a lot of cereal and sugar added onto it. This is a low sugar condition. They ate less cereal. They ate, of course, there was less inside. They put more sugar on it themselves, but they didn't get anywhere close to the amount of sugar that their friends in the other room were getting from the pre-sweetened cereal. Then the most important thing to realize is the recommended serving size is 30 grams. So the low sugar condition, the kids actually ate an appropriate amount of cereal. The high sugar condition, kids were eating twice as much. Now, if you're a cereal company and your job is to sell cereal, of course, you want to sell high sugar cereal because kids are going to eat more and you're going to sell more cereal. But if you're concerned about childhood obesity and trying to help kids self-regulate, this indicates that you should really focus on the low sugar cereal. So there were big differences. The kids put more fruit on the cereal in the low sugar condition. And we publicized this. We did a presentation at a conference. We were on Good Morning America. We had coverage in Time Magazine. And people noticed, and General Mills and Kellogg's noticed. And within that next year, General Mills came out and said they were committed to reducing sugar. They're making progress. So it wasn't just us, of course, but we were part of the voice of advocates. And this is where I think someone over here said earlier, like, if I, how can I change policy? How could I change a company like General Mills? Well, you can. You can be a voice, you can be an advocate, you can contact those companies. They actually pay attention to what consumers say to them. And they responded. They said, we heard from parents, this is what parents want. Then, of course, once one of them does it, the other ones do it. And then that's a thing that you can think about both in terms of changing the companies, but also what you can do at home. So quickly, change the default. What can you guys do? Create a policy that you have a variety of only low sugar cereals in schools, childcare, aftercare programs. Ask local restaurants and chains to automatically provide milk and fruit instead of soda and fries on the children's menu. I'd be curious, McDonald's is a franchise. Each franchise, has somebody who owns it. I'd be curious if as an owner of a franchise, you could make that choice and say, at our McDonald's, we have apples and water that go with our kids' meals, or apples and milk that go with our kids' meals. The debate, which you guys, I'm sure know, there's a huge fight, personal responsibility versus the nanny state. My answer is there are no true choices. We want people to be personally responsible, but we're setting them up to fail by putting them in an environment that works against the choice we want them to make. So essentially, we've written a paper on this. We need policies to create an environment that supports personal responsibility instead of undermining it. So we have the scale right now. We've got environment and biology on one side, and then we have our knowledge, which we learned earlier doesn't necessarily lead to action and behavior on the other side. What we need to do is we need to move the environment over, have it back up our knowledge, and only with that can we fight against our biology and eat the way that we want to eat. Thank you.
Thank you, Marlene. You'd be available up here for a while. Marlene will be up here if you would like to come up and speak with her and visit with her. I just want to again do some housekeeping here. We started the beginning of our time together today talking it's about the community. We're going to end it's about the community. And so hopefully today you've left with some information, you've left thinking about how you can be involved, and I think the most important thing you should know is we want you involved. Your community needs you involved. If you heard something today that resonates, I would suggest that you want to talk to the people that can influence the outcome. Your elected officials, your school boards, your commissioners, your councilmen, neighborhood associations, and start a dialogue, a respectful dialogue. There is a lot of people that have made this the day that it's been. First of all, I would like to look back and let's give a round of applause again for all of our exhibitors and people that spent the time to put their displays together. We referenced all of our sponsors, and I'm not going to go back through those today, but you know, that bus is not there without the help of the U.S. Conference of Mayors, the American Beverage Association, Potash, Husky, West Ohio Food Bank, others. So it's important to acknowledge them. There's also two people that really worked a lot behind the scenes, and that's Sally. Would you and Lauren stand up, please? These ladies really worked a lot to do the programs and to get the information together and the registration. It's easy to find out where we are. The Activate Allen County office is in the annex at the former YMCA or the older YMCA. You've met Cherry Mitchell, and if you're on the team, Cherry, Josh, Denise, Nancy, are you guys out here, Lauren? Are some of you still out here? You know where they're at. We have a great opportunity with the resources that the Center for Disease Control has provided to build capacity. And that's really what we're about right now, building the infrastructure and capacity from the human perspective to begin implementing change in the future. So it's up to us to take advantage of all of that. And I just want to make sure that I've got everything else. Oh, remember, take your veggies home with you. And thank you for coming. Dr. Schwartz is up here. The rest of us are up here. But thank you so much. Have a good evening or afternoon.